My name is Edmund, and I just turned 70. I worked in municipal finance for my whole career, based in New York. I started traveling, international travel, when I was in college, and I pretty much never stopped. All in all, I've had a blessed, fortunate, active life. I worked down there for 5 years. I walked past it every morning. I had a bloody nose, which is something that I didn't really think would be very serious, but it didn't stop for a couple of weeks because the cancer had gone from a little infection the size of a golf ball in the top of my mouth. I was told that they would have to remove the whole center of my face, and I decided I did not want to do that, but I had to do something because I realized it was a very critical situation. The good news is that I lived. The bad news is that in the course of the radiation chemo that I had, I lost all my teeth, all my upper jawbone, and I had a symptom called necrosis, which is where the bone continues to die. For years, I could not eat, couldn't chew. I basically was physically deformed. I mean, I realized the way I was perceived by society and stuff, but it really didn't stop me at all. And I did start looking into how I could basically have teeth again.
Edmund had seen a bunch of practitioners, and he came to our team feeling pretty desperate. And I thought initially when I saw him that, yeah, we could help him.
Edmund's situation is really pretty unique, and we're a plastic surgeon who's part of the Northwell system as well, who knew what we were capable of doing as a team.
We have what I believe to be the best head and neck reconstruction program in the city. The combination of the expertise on our team allows us to restore patients' form and function after they've undergone these devastating cancers or injuries.
I think for Edmund, who had had a lot of surgeries, it was really appealing to say, hey, we could probably do this in one shot.
We actually start out by virtually designing a set of teeth that will go on the bone that we plan to bring up to reconstruct the defect.
In this particular case, we harvested a bone from his lower leg, and we shaped that bone into the appropriate shape for an upper jaw that can be used to restore the face.
Secured it to the remaining part of his upper jaw, which is the maxilla, put dental implants into that bone, and then put teeth on that.
We set pretty high goals with his case, and he's doing so well at this point. We're very happy with how things turned out for him.
It's somewhat remarkable. After 5 or 6 years of mashed potatoes, I can now bite into a pizza. Having found them and having decided to have them work with me really made a big difference in my life.
Dr. Hirsch and Dr. Brecht actually developed this jaw-in-a-day concept where dental implants and the teeth restoration can occur simultaneously because we can compress the time quite a bit.
This team really focuses in on that patient-centric care. The technical portion of it, yeah, we do that better than anybody, but I think what we do better than the technical portion is we really take care of the whole patient.
I think we're successful when we see that somebody smiles and they smile with their eyes, really returning a person to that sense of wholeness. It's a great feeling.
If even one person hears my story and decides to pursue a solution to their problem and realizes that it's possible, well, then to me it was very much worth it.